Hello all, welcome to Medical Equipment Explained. If you've ever wondered how the equipment used on you works, this is for you. Today's topic is one of the highest importance in avoiding acquiring an infection from a surgical site. We'll be discussing the equipment that performs sterilization of surgical instruments, but is often forgot about or overlooked. The steam autoclave, or more commonly known as the steam sterilizer, is a device that is crucial for making sure that surgical instruments and similar tools are safe from bacteria, viruses, and the like. The autoclave is not the only way to ensure sterilization of equipment or instruments, and in fact can damage some temperature-sensitive equipment. Those such as hydrogen peroxide will likely be covered in another video, but today we're discussing the steam autoclave. These autoclaves can range from small, tabletop-sized office or clinic settings to large chamber autoclaves as seen here. I'll mainly be discussing the steam autoclave in the hospital setting as that's where the majority of my experience lies. The autoclave has more uses than just surgical instrument sterilization. It can also ensure that laboratory and clinical equipment are safe from pathogens. The steam autoclave is similar in a way to a pressure cooker, just a more controlled type. Except a pressure cooker only builds up pressure to cook your food. An autoclave will build up pressure but also creates a vacuum to remove moisture from instruments being sterilized because water droplets can harbor pathogens. To go over some of the major components of the autoclave, let's take a look inside. Starting from the largest, we have the pressure chamber itself, the heat or steam source, the door or lid, the pressure control valve, the air removal valve, the drain valve, and the pressure and temperature gauges. Steam can be supplied from a central source, such as a boiler elsewhere on campus, and then the steam can be piped through the building all the way to the autoclave. Or steam can be produced in a smaller boiler dedicated to that autoclave. Pressure and steam are built up in the pressure chamber, and sterilization of the instruments occurs between 121 and 132 degrees Celsius. To ensure that all the microorganisms are killed, it is important to hold the pressure and temperature for about 15 minutes, after which the superheated steam can be evacuated and the instruments allowed to cool and return to normal pressure. The instruments are now sterile and ready for use in the surgical suite. With all that being said, the equipment that is often overlooked is crucial in avoiding infections.